This is a breast augmentation study using the Allergan Style 410 implant. It's done by Dr. Frank Lista and Associates from Toronto. It's a retrospective study involving 440 patients accrued over 10 years. The approach is an inframammary crease incision, and all implants were placed in a subglandular plane. The average implant size was 385 grams. The average follow-up was only 13 months. I feel that this study is honest, non-proselytizing, and objective. The 410 implant is a textured, anatomic, highly cohesive gel device that was introduced 20 years ago. It enjoys wide use worldwide and has just been approved for use in the United States. Some of the claims have been that it gives better breast shape, that it lasts longer, less capsular contracture, less rippling, and less need for reoperation. The pre-market approval study done in the United States in multiple centers showed that 492 patients followed over 6 years had a complication rate similar to that of other implants. The reoperation rate was still pretty high at 19%, and it was done not only for size change but also for problems with the style itself and for malrotation. That study noted that there was less wrinkling and rippling with this device. The findings of this study showed a reoperation rate and a capsular contracture rate that is similar to other devices. No better, no worse. Most reoperations were done for aesthetic reasons. There were significant problems with malrotation in 5.2%, seroma in 3.4%, and rippling in 3.6% of patients. The malrotation patients were largely treated non-operatively with stabilization with a tight-fitting bra, but the long-term fate of those patients is not really clear. Late seroma required secondary surgery in most patients. A double capsule was seen in half of those patients. All were converted to smooth round implants. Cultures and biopsies were sent with no abnormal findings. Rippling almost always required secondary surgery when significant. Other findings that were brought up in the discussion, there was one study that was a photographic review of anatomic versus round implants, in which most of the reviewers, both lay people and plastic surgeons, could not tell the difference between the two devices. That breast beauty was rated as the same, but that naturalness and upper pole fill was rated better with the round implant. A breast Q survey showed that there was no difference in any parameter between the two implant types, but that the form-stable implant was more firm, as noted by the patients. So what are the issues with the 410 implant? Well, it's more firm than the standard round implant. You need a longer incision, and you're probably restricted to an inframammary crease approach alone. There are significant issues with malrotation and rippling, late seroma, defined as occurring more than a year after surgery, with double capsules seen in many of those cases. Fortunately, there's been no link to anaplastic large cell lymphoma with these devices, or any other. So what's the role of the 410 implant? Well, in my opinion, it's probably not going to replace the use of smooth round implants in the majority of patients. However, like saline implants, there are probably some instances where it is a superior device. For example, the patient with a vertically short, horizontally wide breast with a high inframammary crease, or the tall patient with a narrow chest who wants high volume. These are probably excellent devices for those applications. However, where it will actually find its role in breast augmentation surgery today remains to be seen.